I mean, it's really important to have a meeting focused on pigmentary disorder. We just made an international survey showing that in the world, there are at least half of the people claiming that they are suffering for at least one pigmentary disorder. They have studies demonstrating clearly the impact on the quality of life. The stigmatization is really important, and there is also a lack of good treatment for many of these hyperpigmentary or also hypopigmentary disorder. We have advances in melasma and vitiligo, but there are, for example, other diseases such as lichen planus pigmentosus that is very difficult to treat. PIH is really an issue in our daily practice, so we really need to better understand how it works to provide better treatment for all our patients. So I'm very glad that this kind of meeting has been developed, and I'm happy to be there.
In dermatology, we treat all Fitzpatrick skin types and all ethnicities. And even though beneath the surface all skin looks alike, that very thin pigment layer on the skin surface is very important. It can create various diseases. It can also cause us to look older or younger than our stated age. Understanding pigment production, and pigmentary diseases is very, very important. It's a big and growing area in dermatology, and having a meeting devoted to that is very important because it allows people to focus on that area. It allows us to bring in experts to speak on that area, and it also provides a lot of food for thought in this rapidly evolving area of medicine, which is pigmentary issues and disorders.
Yeah, so I think it's important to recognize that different skin types look and react differently to disease. And so a lot of times we use erythema or redness of the skin as a sign of a certain rash. And erythema shows up differently if the skin is very light versus very dark. Those are some of the things diagnostically that are important. You know, what does scale look like? What does erythema look like? How do rashes appear differently? What about skin cancers? You know, the risk of skin cancer is different in lighter versus darker skin, and can look differently and be on different locations. Those are really important factors. Many times, just simple things like hair care is very different in light versus dark skin. And I remember when I was a resident counseling a patient on how to treat her dandruff. And I said, you know, use this. I'm going to give you a shampoo. You should use it every day. And she said, every day? What? And I said, oh, I'm sorry. And she said, I only wash my hair once a week. If I washed it every day, it would break and be dry. And I never forgot that experience and needed to remember that not everybody's hair is just like mine, because I need to wash every day or it gets greasy. So that was an experience I really took to heart and said, wow, I've got to really think about each piece and how that can be different. I had breakfast with an attendee this morning who said that he came because he's seen a total of 10 patients with dark skin in his entire residency, and he's about to enter third year. He's from Utah, so not a lot of exposure there to skin of color, and that's really important. He's actually from Mexico. And so he needs to be able to have that knowledge and that experience. And so this is a great opportunity to fill that gap for him and many others who are in a similar situation.
What is it important, especially in light of where we're at with pathogenesis, with all of these new drugs coming out for pigmentary disorders, with an awareness, like how is the kind of environment changing where
Right.
it makes this really important? What is it important, especially in light of where we're at with pathogenesis, with all of these new drugs coming out for pigmentary disorders, with an awareness, like how is the kind of environment changing where
Right.
it makes this really important?
Right. So, you know, I just talked about all the reasons why, just baseline, it's so important to have the education in skin of color for general dermatology. Layer on top of that all the changes that are occurring, you know, all the new discoveries that are being made, the new treatments that are being developed, and the fact that we previously talked about the fact that a lot of dermatologists have told their patients there's nothing to treat vitiligo. We've got to get that knowledge out there. And so that people are prepared to counsel their patients, use the treatments, offer the treatments to make their patients better. This is a great environment for it, and you can spend a couple days and learn a ton, and from the leaders in the field, which is a pretty exciting thing to do, I think.
It's so important for us to have a meeting focused on pigmentary disorders. I think this is just really a highlight. I've been practicing for over 20 years. I treat a lot of pigmentary disorders, and it's so exciting for me to come to a meeting that focuses 100% on disorders of pigmentation. So there's so many new treatments, there's lots of new technologies, but also new basic science research. And I think having a meeting dedicated 100% to disorders of pigmentation is really important and really helpful for a practicing clinician.
I think it is so important to have a meeting totally focused on disorders of pigmentation. I think it's important to educate dermatologists in the House of Dermatology, and I'll go so far as to say the House of Medicine, regarding the history, can I just pick that up again? Can I just start? I think it is important. Of course. Okay, great. I think it is important to educate dermatologists and at a broader level, physicians in the House of Medicine on the history of pigmentation, the culture of pigmentation, and the science of pigmentation. Pigmentation influences the clinical presentations of many conditions. It can lead to diagnostic dilemmas, differences in how we approach diagnoses and evaluations. So the beauty of this meeting is we take a deep dive into clinical presentations, pathogenesis of diseases, and a spectrum of treatments that are relevant and applicable for all skin types. And in my opinion, that is what is truly unique about the Pigmentary Disorders Exchange Symposium. Our deep dive in addressing pigmentation for all skin types.
So pigmentary disorders are so common. We see them across the world globally, and we know that also for our patients of color, it's one of the more common reasons for why they come in to see a dermatologist. So I feel really strongly that every dermatologist and every healthcare provider in the dermatology space should feel really comfortable knowing how to diagnose, manage, and treat pigmentary disorders. And, there are so many. I think a lot of times pigmentary disorders get clumped into, broad categories, but it's so important to actually really know which disease type someone has, and then again, how do you treat it, and does that treatment differ depending on the person's baseline skin color and, how you're going to manage diverse patient populations. So I think there's so much that we're learning and continuing to learn that it really does merit having its own time and space for these pigmentary disorders.
When you have medicine and you break it up into algorithms that are very easy to understand or very customized, very well-trained recipes, they're two different processes. You can look up an algorithm on how to treat a disease on Google, and you can find the right resource very quickly. You can't figure out how to make your mom's key lime pie perfectly without really watching her do it. Pigmentary abnormalities require a lot of interface between faculty and attendees, mentorship at the academic level. And if you don't have meetings like this, you don't get the conversations, you don't get the question and answer, because what we present on stage is limited if you don't take our own personal experience. But our own personal experience is also full of bias. If you combine that with the experience of the attendees, we end up getting better ideas, better study designs, and then there's also a desire of industry, of payer groups, to start looking for better treatments. So if you ask me, why is it that you need a meeting like this, my question is, why did it take so long? I should restate that. If you ask me why we need a meeting like this, my response is, why did it take so long?
Pigmentary disorders go to the root of how we recolor from an injury or from a condition, and either hyper or hypo, from vitiligo all the way to melasma or PIH, we need to understand how that happens. And when we induce the injury, we have to understand that even better, right? Because we're the ones causing the injury. And so I think it's extremely important to understand the whole process and how to, for example, to create color with using agents like bimatoprost, and how to get rid of color with agents like hydroquinone or other things. So you have to make the skin darker or make the skin lighter. And that's really important to know how to do. So that's why.
I think pigmentary disorders in dermatology is an area that is gaining more and more focus and deserves more and more focus. It's rare to provide that a meeting like this one gives us such a deep dive and great insight into the various facets and way pigmentation affects patients' lives and the nuances of the diseases in pigmentation. And so I think there's great value in having a full 2 days dedicated to disorders of pigmentation, and also bringing in experts from the medical and procedural aspects in order to deal with these conditions kind of comprehensively.
The PD 2024 meeting is the first time I've attended a meeting that specifically focuses on pigmentary disorders in all skin types, and that is it. We're not talking about vascular lesions. We're not talking about advanced resurfacing techniques for wrinkles. We're only talking about pigment, and we've brought in experts at all different levels, from basic science to clinicians, that can speak about not only the pathogenesis of pigment, but how to treat it in the same session. And that's very unique, and that's something that I think should attract audiences to come and hear about.
I think it's so important to have a meeting that is dedicated to pigmentary disorders, and I'm so pleased that Dr. Grimes and her colleagues have put together such a meeting. Pigmentary disorders represent such a huge burden for our patients in dermatology around the world, and historically we've had very little education and research and treatment options for these disorders. So to be able to come to a meeting like this and have the world's experts in pigmentary disorders, whether it's hyperpigmentation disorders like melasma or depigmentation disorders like vitiligo, having everybody come together and share the latest cutting edge research as well as practical pearls from the experts on how to manage patients with disorders of pigmentation is really huge, and I'm really, really excited to be here in its second year.
Well, it's very important to have a meeting dedicated to pigmentary disorders because I think, first of all, there's a lot of dermatologists out there that don't know, especially with lasers and chemical peels, that you can treat all skin types. And I often get patients that say they heard from another doctor or even a dermatologist that their skin wasn't safe for laser, and that's just not true. We have incredible technologies, and the chromophore is either melanin or water, and they're fractional, and they're radio frequency and microneedling that actually are made for all ethnic subtypes. And so it's so important that we learn these techniques for all skin types in dermatology.
To have a meeting specifically on pigmentary disorders, because there has been I don't know, this is something I talk about all the time. I don't know why.
Right, usually that was a huge place.
Okay. Treatment of pigmentary disorders tends to be very challenging, particularly if we're treating individuals with skin of color who, well, that only regards laser treatment. I don't want to use the word ignored, but there are a wide variety of pigmentary disorders that cause significant significant amount of distress to patients and impair the quality of life. In general, there's been a lag in terms of the amount of research and education that has gone into treating, I'm going to repeat this, treating pigmentary disorders. And we have learned so much in the last decade about mechanisms of action and have new potential medications and energy-based devices for treatment. But there's a lack of general education and experience to deal with treating pigmentary disorders in general. I'll say that again.
And it can be, you can make it as short as you want to.
Out of all that, we'll probably use one sentence.
Okay.
So if you have a one best sentence, that's great.
Okay. Pigmentary disorders can be extremely distressing to patients and be life-altering in terms of their quality of life. And so there's a great need to educate physicians on how to recognize these disorders and understand the potential treatments, both topical medications, systemic medications, as well as laser and energy-based device treatment. And this comprehensive, in-depth meeting.
You can take her from this.
Yeah.
This and the Pigmentary Disorder Exchange. The Pigmentary Disorder Exchange Symposium answers this unmet need in terms of giving an overall comprehensive and deep understanding of the pathogenesis of these treatments, as well as all the available therapeutic options. Should I repeat that one?
As well as all the...
Okay. As well as all the available therapeutic options.